Asthma is a chronic condition of the lungs where the small airways in the lungs can become constricted or even smaller and get filled with mucus and become swollen. So it limits the amount of air that can go through the lungs, and thus you get less oxygen. With that, the symptoms can be chest tightness because you feel those airways constrict, shortness of breath, obviously, because there's less oxygen. The wheezing that sometimes you can hear, sometimes only a physician can hear, is when that air is trying to squeak through those little airways. Sometimes in children, the symptoms can be much less dramatic. They just may cough. You don't think, oh, the cough, 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 cough. You know, you're not thinking that it's asthma, but nighttime cough, particularly in children. Sometimes children just get less energy. They may be playing with their friends and just come in more tired. So the symptoms in children can be much less dramatic than an adult who can say, gosh, I feel really tight today, or, you know, I hear that wheezing. So those are some different things between adults and children's, but the kind of reason behind it is the same.
The body senses different, what we call antigens, which can be anything from dust or smoke or cat hair or things along those lines. And the body treats this as if it's a foreign invader.
So it's really important to try and prevent an attack occurring. And there are several things that we can do to help with this. Firstly is adherence or compliance with inhaler medications. Generally, inhalers are very effective at preventing asthma attacks. Clearly, it's very important that the asthma inhaler is used correctly, and something that I spend some time with my patients is to make sure that they have the full knowledge about how to use their asthma inhaler correctly. So use of an inhaler regularly and correctly is a really important part of this. In addition, many patients with asthma will benefit from having a flu vaccine, which can be had annually, as well as the Pneumovax vaccine, which may prevent against pneumonia, which is often administered every 10 years. Finally, many people with asthma will realise that there are triggers other than infections that make their asthma worse. So, for example, exposure to dust or certain pets. And in this situation, clearly it would be helpful to avoid those precipitants as much as possible.
There's a new technology in the treatment of asthma that's called bronchial thermoplasty. We use this technology in folks who have severe asthma and whose symptoms have not been controlled with usual medical therapy.
Adults with uncontrolled asthma often make repeat trips to the hospital, and over time the chronic condition becomes permanent and damaging.
The tubes that take air into their lungs are inflamed. With years and years of inflammation, that tube gets scarred.
The first non-drug therapy FDA approved to treat severe chronic asthma, bronchial thermoplasty directly targets the inflamed airways, and by applying heat gets them to open up.
What we do in bronchial thermoplasty is we take a thin, flexible fiber optic tube with a camera at its tip from the nose down into the lungs. We take it to each individual breathing tube, and at a very, very low frequency, we emit heat energy that allows that muscle around the breathing tubes to shrink.
This technology is available through Lee Memorial Health System. Nationally, data shows the effects have staying power, that 5 years post-procedure, there was a 78% reduction of asthma-related ER visits.
Being well controlled is a huge improvement,
making this hot treatment a life-changing procedure for people struggling to breathe. For Lee Memorial Health System, I'm Amy Osher.
In terms of exercises for asthma, the most important thing when somebody's having an asthma flare is for them to breathe calmly and slowly. Sometimes patients will hyperventilate, where they will breathe very shallow and rapidly, and Again, we'd like to have them breathe slowly and calmly. And sometimes if somebody is in an asthma flare, obviously they need to be treated with medications, and if it's a severe flare, they would need to seek medical care immediately. But if it's somebody who you're trying to get them to breathe more calmly, sometimes sitting with them and sort of modeling the way to breathe, in other words, just taking a slow, deep breath and then letting it out can be helpful. But again, somebody who's in severe distress would need to seek medical care promptly.